The process starts when the patient decides with the team that a feeding tube is indicated and it's time to do it, or close to the time to do it. At that point, usually the pulmonary office will contact my office, and then we try to cater it to the individual patient. Some patients will want to come to my office to meet with me to discuss it. My office is on Outer Congress Street, not quite to Westbrook, and we can talk about it there. I can go through the instrumentation. Other patients would prefer just to meet me in the endoscopy suite, and then we get the referral from the pulmonary office, Dr. Zuckerman's office, and we schedule the procedure. It's almost always on a Thursday at Maine Medical Center, and then I'll meet the patients up here, and we'll get to know each other for a few minutes beforehand. I'll put the tube in, and then they head home. I do this procedure in the endoscopy suite at Maine Medical Center. It's on the 4th floor, far away from the operating room. It's a dedicated suite to doing GI endoscopy. The procedure usually takes 5 to 10 minutes, sometimes 15, but that's by my clock. Every patient is sedated, so to them it's a blink of an eye because you're not really aware that we're doing it. But it takes about 5 to 10 minutes to do. And you come into the room, we give you some sedation. Once we're sure that you're sleepy, then I do the procedure, and then you wheel on down the hallway for a few more minutes, half hour, hour, maybe even an hour and a half, just to wake up, recover until you feel like you're ready to go home, and then off you go. Once the tube is in, there's not a lot for you to do with the tube. You go home and basically keep the area clean. And I'm fine the next day with a person showering. That's really not a problem. Some people want to keep a gauze bandage around it. Sometimes these will bleed, never much, but just bleed a little bit, and just to protect from a tiny spot on your shirt, or some people put a gauze dressing on it for a few days. But that's optional from my point of view. A dressing is optional, or a bandage is optional. Showering the next day is fine. The discomfort is, for most people, it's a Tylenol level discomfort. Once you've decided to have a tube placed, or the team has decided this is the right time for it, there are two choices for tubes. There's the standard PEG tube, and PEG is percutaneous endoscopic gastrostomy. But there's the standard PEG tube, which is put in and generally dangles about 10 inches from the abdomen. It can be any of various ranges. And that's the standard PEG tube that most gastroenterologists are comfortable putting in. Then there's the MIC tube, or the Mickey tube. That sticks up all of about 1/4 of an inch from the skin. It's flat, it's got a little pop top cap on it. A lot of people like that tube. Generally about a month after the procedure, I like to see people in the office just to check the healing, make sure the tube's working okay, and generally any problems are going to be detected well before then. But I like to see everybody at least once in the office afterwards. And then I'm available forever if there are questions or problems.